Hey, I'm Dr. Seiler from Seiler Skin, and we have multiple videos on our website of all of our procedures, and one of our most popular videos are the videos that I've already previously shot of me doing what I call the liquid facelift, which is using Juviderm and Botox to revolumize the entire face. That's been done in videos on our website and another video, but I wanted our marketing director, Jill, to shoot this separate video of me just injecting the lips, because it's probably the most common area that people want done but are also very concerned about it, whether they've had it done before at another place or they haven't had it done and they've heard issues with it. The biggest concern that my patients voice before they end up doing this procedure with me is they're worried about how much it's going to hurt. So the purpose of this video is really to show specifically how I do the numbing shot, which people are also concerned about. A lot of other places in town that are not as skilled maybe will not use the numbing shots that I do, and they simply use a topical numbing cream, which in my book does not numb the skin near as well. So I wanted to demonstrate on Jade here how easy it is, number one, to get through the numbing shots through the mouth, and then how numb they are afterwards. So if you haven't had this done yet, this will be a good thing for you to see. If you've had it done before at another place and you found that it was very painful, you'll see how easy this procedure is to get through. And we've already injected or numbed this side of her face before the video for time's sake, and so you're going to watch me numb the right side of her upper and lower lip and nasolabial fold and cheek area with a numbing shot, what kind of like a dental block, and then we're going to do the injections. All right, lean up for me. All right, bite down. And so you'll see we just do a little shot here superficially, and then I kind of massage the skin so they don't feel it too much. For those of you that are watching this video for training purposes, the trick is to make sure you know the anatomy, where the nerves are, and also inject very slowly. And usually the patient doesn't feel any discomfort. You okay, Jade? Mm-hmm. This is probably the procedure that patients come in ahead of time that they want a lot, but they're also very concerned that it's going to hurt because they've heard from other places that it's very painful. I have some of my patients that have had it done before at other places, and they swear that they're never going to do it again, and then they have it done here. And I had one patient about 4 or 5 weeks ago that came in that had it done about 2 years ago and was very unhappy and had it done with me and gave me a huge hug afterward because they were amazed at how much easier it was to get through. Alright, so now we've numbed that whole area right there. I always tell patients, I'm very honest with them, the only downside ever to doing the numbing shot is that you are numb for a couple hours afterward, and patients expect that ahead of time, that they're going to be a little goofy talking afterward just because they're numb, but no big deal. It makes the procedure very, very painless. So we're going to inject a little bit of filler in this area and here, and then we're going to do the corners of the lip. I'm not going to do the entire procedure on video just so that we keep this video kind of short, but I'm going to show you a couple of injections in the areas that we're going to do just for you to see that all of the areas in her are going to be, if not completely numb, at least very numb enough for her to be able to get through this easily. The other advantage is that then they don't have to sit through an hour's worth of numbing cream before and still feel a fair amount of pain. Alright, you ready, Miss Jade? Mm-hmm. So here comes the first little injection. You feel anything? And just so that everybody knows, this is Jade. She's my medical assistant, but she would definitely tell me the truth if she was feeling anything, and she doesn't seem to be. So for those of you watching, you can rest assured that she really is pain-free here. Sometimes you feel a little bit on the corner of the mouth. Do you feel anything there?
No, just a little poke.
A little poke.
And what are her concerns that you're addressing with the Juviderm?
So Jade doesn't really have much, so she's lucky. She's got good cheeks, so we're going to put just a little bit of filler here eventually. I'm not doing it right now for sake of time on the video. Jane's biggest concern is we have done Fraxel laser in her in the past, and she saw a nice improvement on the lines around her lip, but she's got a little bit of lines around her mouth here that you can still see, and so therefore we're going to inject and fill in these lines. This is something that you have to be very careful doing. You have to have, honestly, a lot of experience to do this so that you don't overfill the patient. Do you feel that little stick right there?
Not at all.
Good. So we're not going to keep this video going too long for you to see the whole procedure, just for sake of time and everything, so that y'all can watch a relatively short video. But I've already filled a little bit of both the upper and the lower lip. And Jade doesn't need anything in the bulk of her lips. She's got great lips here in the middle. She's just lost a little bit of volume in the corners of her mouth. She's got a little bit of a down-turning corner of the mouth here. You can see her feeling that just a little bit, but not too bad, hopefully. This Juviderm also has a little bit of lidocaine in it too, so even if the patient feels the very first little stick just a little bit, they're still relatively numb after all that starts. So
why do you choose? I'm sorry. Why do you choose Juviderm over other fillers?
I think Juviderm's the best filler, honestly, on the market. I haven't used Restylane in years. I think Juviderm lasts a lot longer. It gives you a much better natural fill. I think that it's very it's a really good gel. So they get not only a volume fill from the amount of gel that you put in, but also it absorbs water, and so it kind of expands and settles in with the next 2 to 4 weeks, and so they get a really nice fill. That's also why it's important to know your product and know how much extra fill they're going to get so that you don't overfill them with the treatment. It is reversible. If a patient has come from another office and they're really unhappy with having Juviderm somewhere else and it was put in the wrong place, then there is an enzyme that's made that will digest it. I've never had to use that on one of my own patients. I have had to inject that into a couple of patients that have come from other offices, luckily. But so I just think it's a very long-lasting filler. Most of the time we tell patients 6 to 12 months, but most of the time patients get at least a year out of it. Some of the more longer-lasting, more permanent fillers have a much higher risk profile. They tend to be more easily felt in the skin. Patients complain about really being able to feel the filler in there. And I think Juviderm has the best result and least risk, and I just think it's the best product on the market. I've got a lot of experience with it. I've been using it probably for about, I guess, 4 years now, since it was FDA approved in the United States, and I love it. You'll see in some of my other liquid facelift videos that I can inject all through the cheek area. We can inject under the eye. I can even inject the nose to give people a little bit of a nose lift, if you will, for people that have a little bit of cartilage prominence on their nose, people that don't really want a nose job. I can do a little bit of an eyebrow lift with it. We can round off the jaw with it. All those things are done in another video that's on our website if you want to check those out. So you can see, and I'm going to finish up afterwards. We're not finished with the procedure yet, but you can see that we've already injected a couple of different areas that I'm going to fill in even greater here in a minute. But we've injected this area here, we've injected the lip, we've injected this area right there, and we've injected below the lip. All 4 of the areas that tend to be very painful if the patient's not properly anesthetized. And by a simple little shot inside the mouth that you barely even feel me doing, you can see that she's very comfortable. She did honestly feel this little stick down here. You saw her kind of blink just a little bit, but it was minimal discomfort. And I take my time. I hold pressure to make sure that the patient doesn't bleed so that the risk of bruising afterward is minimal. And that's why you see me hold pressure just for a minute on this corner of the mouth before we keep going. If you have any questions, I'd be happy to see you for a consult, and you can even talk to Jade about her experience. We do have a couple of patients that have given us permission to give out their name and phone number that have had this procedure done, that you're welcome to call the office and get that list of patients that you can talk to about this procedure, just to confirm that their experience has been the same as what I've described in this video. And I hope you come see me for this procedure. Thank you.